My name is Candace Henry, and I'm an 18-year colorectal cancer survivor. I was diagnosed at the tender age of 35 years old. I was misdiagnosed for 6 months and wind up having a hysterectomy because they assumed that my issues were female related before finally finding out that I had colorectal cancer. That journey was one of psychological trauma, financial trauma as I became homeless trying to fight cancer. It was traumatizing to my children, and it took a toll on my mental health. I was never offered psychosocial support, and that was something that I didn't know I would have needed until it got to the point where I was at the lowest point, where I couldn't take care of my children, I couldn't take care of my finances, I couldn't return to work. I had no patient navigation services. Once I left the hospital, I essentially became invisible to the healthcare team. And the only call that I ever received was a few days after surgery, and that was to see how my wound care was going. But no one ever asked if there was anything else that I needed. I would say that the journey itself was totally unexpected. I can remember my surgeon saying to me that he had expected me to return back to normal, right? And I couldn't imagine how he could think I would return back to normal when they had removed my entire large intestine and a resection to my small intestine. And I'm thinking to myself, what's normal? I think the message that I want for people that are diagnosed after me is to be your own advocate. Don't be afraid to ask questions. Always have someone with you when you are going to a visit, because you want to know. And sometimes we are so traumatized by hearing that we have a cancer diagnosis that we forget everything else. And I have met so many patients who have said that they didn't want to know what their staging was, what the prognosis. You do want to know, because there's nothing like hearing the words, there's nothing else we could do for you. And so many people I've encountered have said they wanted to live after they found out that they were going to die. And so my message is, no, empower yourself so that you can empower your family, you can empower your children, so that if something is to happen, and you want to know whether or not it's hereditary, you want information about genetic testing. So if this is something that's going to be passed down to your children and your family lineage, you need to know that so that they can prepare themselves and so that they're not caught off guard like I was. I didn't know that my father was diagnosed with colorectal cancer autopsy at 42. Had I known that, I would have been tested earlier, 10 years earlier. I would say to the healthcare system, do better. Listen to your patients. Have empathy and understanding that when your patients say that they have fear, understand that, listen, and find a way to comfort them. Offer psychosocial support before, during, and after the cancer diagnosis. That makes a big difference. I wish someone had offered that to me. I think it's important that everyone know that this journey, you don't go through this journey alone. You're not the first person, and you won't be the last. But what's important is to just take one day at a time. Live until you can't. Every day you wake up, you are a survivor. Every day. Take a step more than you did the day before. Get up, exercise, read a book, do something that is going to energize you, mind, body, and spirit. Because who's to say what our next day is going to be? But if you lay around and just allow yourself to be taken in by cancer, then that's exactly what's going to happen. So I want to empower you, and I also want to challenge you to see how far you can take yourself. How far can you go in terms of managing your health, managing your survivorship, and allow your friends and family to help you? There's no shame in cancer. It's not your fault. You didn't do anything, but just know that there are people that want to help you and support you, but they can't do it if you don't let them in.